Have you had that knee pain and you don't know what's causing it? Is it arthritis or is it the meniscus tear? I mentioned those two because those are the two most common causes of knee pain. In this video, I'm going to tell you which one is which so that you may know what is causing your knee pain. And knowing what's causing your knee pain will help you arrive at the right treatment. So make sure you watch to the end so you have full understanding. First, let's start with knee arthritis. Knee arthritis usually affects older people. It's a gradual in onset, so it doesn't occur just overnight most of the time. You're gonna feel that deep, achy pain. It's more generalized around the whole knee area. And you also will notice stiffness, especially in the morning. When you wake up in the morning, your knee will feel stiff, but then it gets looser as you start walking or as you start moving. That stiffness can cause some limitation in your range of motion as well. So you may see some difficulty in bending or fully extending your knee. Aside from the decrease in range of motion, you will also notice some crepitation or some grinding on your knee. You may feel it sometimes. We describe it as you feel like you have crunchies there. And then if it's worse or more severe cases of arthritis, it can cause joint deformities. If you found this information helpful, make sure to hit that subscribe button and turn on your notification. Now let's go to a meniscus tear. A meniscus tear can happen at any age. In younger people, it can happen after a certain incident. In older people, it can happen as the arthritis gets worse. It's gonna wear down the meniscus and then it's gonna cause that tear. The pain usually is more sudden in onset, especially if it's after an incident, and it's also a sharper type of pain. You're gonna feel that pain on that inner part of your knee. It's more specifically that inner joint line, that medial joint line. And that area will also be tender to the touch, meaning when you press on that inner part of the knee, you're gonna feel pain. And you're gonna feel a sharp pain, especially when you're twisting or squatting. Usually, the range of motion is normal for a meniscus tear, unless the tear is severe enough or the inflammation is severe enough that is causing your knee not to be able to bend fully, or if a fragment of that meniscus tears off and it will block the two bones from coming together, causing a limited extension or an extension lag, meaning you won't be able to fully extend your knee. You usually don't see crepitations or joint deformities with a meniscus tear. So let's summarize this. If you have knee arthritis, usually you see that in older people. The onset is gradual. You have deep, achy pain. Pain is more generalized around the joint. You get morning stiffness that gets better as you start moving or walking. You have reduced range of motion due to that stiffness. You usually see crepitation or grinding, and it is possible that you might have joint deformities. Or it is possible that you may have joint deformity if the arthritis is severe. Now, for the meniscus tear, that can occur at any age. Younger people with injuries or older people after the arthritis has worn down that meniscus. It is usually sudden in onset, often linked to a specific incident. You're gonna have sharp pain, especially with twisting or squatting. Usually you have no stiffness or minimal at most. Pain is gonna be in that medial joint line and it's gonna be tender, meaning when you press it, and usually you have normal range of motion, or the limitation will be due to the pain, and usually you don't see crepitations or grinding, and usually you don't see joint deformities. So that summarizes knee arthritis and the meniscus tear. I hope now you understand what the differences are, and then you'll be able to check which one you actually have. Now you can check out some knee exercises in this video here.